Childbirth is amazing, but even today, some women are at risk of dying from severe bleeding after giving birth. We call this postpartum hemorrhage, or PPH, and anemic women are at higher risk. Unfortunately, about 1 in 3 pregnant women are anemic. The good news is that Tranexamic Acid, or TXA, has been found to reduce the risk of death from PPH when given within 3 hours of giving birth. We now want to see if it can also reduce the risk of women with anemia developing PPH if given immediately after childbirth. Our 6-step WOMAN-2 trial aims to find out if this is true and potentially save the lives of anemic women all over the world. To make sure we are successful, we're collaborating with excellent teams like yours. This is Isha. Isha has come to hospital because she's in labour. She has been through the usual triage process with admission staff, and her medical notes have been completed. They've also completed a hemoglobin test using the HemoQ HB analyzer, but more on that later. Now the trial can begin. The first step is to check Isha's medical records to see if she is eligible for the trial. She needs to be in active labour, planning to give birth vaginally, and have a hemoglobin level of less than 10 grams per deciliter. She must also have no history of allergy to TXA and be 18 or older. If not, she must have a guardian present. It's worth thinking in advance and making sure you know who will be responsible for different parts of the trial procedures, like the eligibility checks. The next step is to ask for Isha's consent to join the trial. Isha's clinician should assess her first. They should assess whether there's sufficient time for her to properly consider and give fully informed consent, and that she has the capacity to do so. If she isn't able to give fully informed consent, she might be in a lot of pain, close to giving birth, or on medication. Initial verbal agreement may be sought. However, fully informed consent must then be obtained after the birth. After informed consent or verbal agreement has been obtained, one of your team should fill in the baseline form of the case report form booklet. Remember to have the equipment provided in the research bag to hand, ready to take Isha's measurements. Then look at Isha's medical records and take measurements like blood pressure, temperature, and heart rate. At this point, it's important to make sure Isha has an intravenous cannula inserted. This is how the trial drug will be given. When Isha is ready to give birth, time is critical. So, ask yourself and plan in advance who will confirm eligibility and give the trial drug whilst the doctor is delivering the baby. Once the anterior shoulder is delivered, check Isha's medical records again to ensure she is still eligible for the trial. The WOMAN-2 label on the front of her records will show this. Now it's time to prepare the trial drug. But remember, if she needs a cesarean section, or if she develops PPH before the umbilical cord is cut or clamped, she'll no longer be eligible for the trial. Begin preparing the trial drug straight away. Open the next lowest numbered trial drug pack and draw up both ampoules into the 10 milliliter syringe. You should be doing this as the cord is being cut or clamped. With the cord cut or clamped, it's time to run through the final checklist. Make sure she had a vaginal delivery, there was no diagnosis of PPH before the cord was cut or clamped, and there's no known allergy to TXA. Now time really is of the essence. Once the cord is cut or clamped, as soon as possible, give the full contents of the syringe as a slow intravenous injection. As quickly as you can, but no more than 15 minutes later. Remember, no more than 15 minutes. Well done. Now Isha has been randomised. The trial procedures need to be documented in her medical records. WOMAN-2 labels can help with this. Great. There's just one step left. Updating the 2 outcome forms in the CRF booklet before Isha is discharged. Form 1 is completed at exactly 24 hours after randomisation, before discharge or death, whichever comes first. This includes a repeat of the hemoglobin test using the HemoQ HB analyzer we mentioned earlier. To use your HemoQ HB analyzer, take a drop of blood, fill the micro cuvette, put it in the holder, close, and wait for 15 to 60 seconds. The second form needs to be completed either at day 42, before discharge or death, whichever comes first. This includes a questionnaire and a unique walk test. The walk test shows the impact of blood loss. Record how many laps she can do around 2 cones in 6 minutes. The cones should be at least 10 meters apart, but ideally around 20 meters. Try finding some locations to do the walk test in advance and note how long the walking space is. And make sure there's a chair available in case she needs to rest. Great! It's been 8 hours since Isha gave birth, and she is ready to leave the hospital. This means both forms are completed at the same time. Don't forget to record any adverse events. All that's left is to enter the data into the trial database and give Isha the alert card before she leaves. Thank you, Isha. That's it. So, those 6 steps again. 1. Is she eligible for the trial? 2. Get consent or agreement. 3. Collect baseline data. 4. Final eligibility check at birth. 5. Trial drug preparation and randomization. 6. Outcome data collection. Working together with teams like yours, we aim to recruit 10,000 women to find out if tranexamic acid can reduce the risk of postpartum hemorrhage in anemic women all over the world. Are you ready to make a difference? Find out more at woman2.lshtm.ac.uk.